Hello and welcome to another episode of FECAVA Vet Chat. Today we're going over the Great Pond to the United States of America, and I'm connected today with Professor Jerold Bell from the Cummings School of Veterinary Medicine at Tufts University. Jerold is not only a professor of veterinary genetics, but he's also the chairman of WSAVA's Hereditary Disease Committee. And today we would like to speak about a video that has just been brought out by WSAVA highlighting the emerging crisis on dog breeding, especially here the brachiocephalic breeds with upper airway syndromes. These are particularly French bulldogs, English bulldogs, and pugs, but also other dog breeds can be affected by this. So hello and welcome, Jerold Bell. Hello.
Hello. Thank you for having me.
Yeah, thank you very much for joining me for FECAVA Vet Chat. So WSAVA's Hereditary Disease Committee, who is in it? What is the committee doing? Can you tell us a little bit about this committee?
Well, we're a hybrid committee where we have practitioners, veterinarians on the committee. Åke Hedhammer from Sweden, Helle Forskersky from Denmark, myself, Monique Meggans from Netherlands, now she's in Spain. We also have molecular geneticists. We have Catherine Mellish from the UK. We have Leslie Lyons from the United States, who's a feline genetics expert. We have Claire Wade from Australia. And so we utilize their expertise and knowledge in veterinary genetics to assist us in making decisions and trying to improve the way that we address hereditary disease as practitioners. I'm also I'm an adjunct professor at the Cummings School at Tufts, and so I actually am a solo practitioner. I have my own practice in Connecticut in the United States, and I see primarily pet dogs and cats. So I do see what is out there in terms of the pet population. I see what is being bred. I see what is being obtained through the different sources for pets, and I do take care of them throughout their lifetime. So I do see all of the different age-related diseases that we see in practice, and it does help me in being a good veterinary geneticist to understand what we are seeing in terms of hereditary disease in practice.
Yep, that's always nice if we have somebody who's on one hand with one foot in academia, but on the other hand also in general practice, because sometimes this link is missing. But this committee is really truly international and has a lot of knowledge, skill, but also practical applications sort of behind themselves. Some of our listeners will be familiar, especially with Monique Meggans. Monique used to be also a FECAVA president. So, and yes, the hereditary diseases were certainly a subject where Monique is one of the real specialists in the field, I would say. So, the video, how did this come about? Who came up with the idea? What was the idea of producing the video? And also, where do you see this video then be used?
Well, it was actually an idea of Monique and Åke Hedhammer. The two of them are really involved in this subject and felt that we needed a veterinary perspective and presentation on BOAS, but that could be utilized by all stakeholders. So not just veterinarians, but also owners, breeders, government agencies, since there seems to be a lot of governmental influence that's going on, to present the facts about about this syndrome, and to understand what our options are and what options work and what options, although they seem like they're good ideas, they actually are detrimental to improving the situation with these animals. So the banning of breeds, people love these short-nosed breeds, and they want them, and people are going to breed them. Doesn't require a license to breed an animal. So if the desire is there to have them, then we need to work to enable the breeding of these dogs to be to produce healthy dogs, and enable people to have them as pets.
Yeah, the role of the general veterinary practitioner, where would you say, where would we start? I mean, is it I think we have here three different areas. On one hand, we will be, if we are presented with a dog that is brachiocephalic and that has BOA symptoms, then we might have a dog which is a breeding bitch, which is that needs help, because these dogs very often have problems during pregnancy or when they deliver their pups. And also, the third situation is, what should we do if we have a breeder of these dogs who wants our help in helping them breeding these dogs? Sort of, where would be our position as a responsible veterinarian? What would you say?
Well, if you have a breeder that's willing to work with you, that wants to breed healthy dogs, that is the perfect situation, because that's where the change has to occur. Unfortunately, that does not occur the majority of time. And so mostly we're seeing very popular breeds. So we see them often in our practice, where owners have dogs that are affected to some degree with BOAS, and there's certainly plenty of these dogs with short muzzles that don't have BOAS, but certainly there's a large percentage that do, and unfortunately, the person already owns them. Our clients already own them, so it's not like we're influencing that purchase for the next generation of dogs. A lot of times people that lose a dog, want the same breed the next time, and so if we can have them be knowledgeable about what they're looking for, and looking for a health focused breeder that is doing respiratory function testing or evaluating their breeding dogs to see that they are not affected with BOAS, that would be the best situation. And so that is one aspect where we can counsel them. Otherwise, it's just our ability to diagnose these dogs and understand that there are ways that we can improve their lives if they do have sleep apnea and do have the other signs of BOAS that affect their lives and their lifespan.
If I'm a veterinary surgeon, skilled and working in reproduction, and I'm presented with a BOAS dog, where I, from a professional point of view, think this dog is not good for breeding, but the breeder is insisting that they want to breed from this dog or from this cat. What would you say should I do?
For that, it's not always the exact same answer for each disease process, but for this disease process, where you have very popular breeds, where you have high numbers of affected individuals, where we don't have genetic tests, a DNA test for this disease process. So the only selection that we can do is to select against clinically affected individuals. I take a hard line on BOAS, because these are extremely popular breeds, and if we don't breed the affected dogs, we are not going to significantly impact the gene pools of these breeds. They have huge gene pools, so we are, and if what we're removing is a area of the gene pool that has a genetic disease that affects their health and well-being, then I think that's a positive aspect of selection for what we want to do. So if a surgeon is doing surgery on a dog's nares or soft palate because they are clinically affected, I would recommend neutering at the same time. Now, that's not always the recommendation we make with hereditary diseases. When we have other choices, when there are much rarer breeds that are involved, and you worry about the depth of the gene pool and how many breeding individuals are available. But for these breeds and this disease, that is the right recommendation.
Yeah. It's just, I'm sometimes struggling because there are members of the profession who run special sort of reproductive clinics, and they're actively helping owners of affected dogs to reproduce. Is that really in the spirit of veterinary medicine and also the oaths we have given as veterinary surgeons? Wouldn't it be better to say to these dog owners, sorry, but in this case here, I personally think you shouldn't breed from your dog, and I'm afraid I don't want to give my expertise and my skills to help you achieving your goal in getting a litter from this dog?
For this particular disease, we do have a scientific grading system that was established at the University of Cambridge in the UK, and with Dr. Jane Ladlow, where we have a grading system of 0, 1, 2, and 3. So there's 4 grades, and 0 is unaffected, 1 is mildly affected, 2 is moderately affected, and 3 is severely affected. And the breeding recommendations based on what is being produced and the genetics that's being passed on for future generations is that grade 3 dogs should not be used for breeding. That grade 0s and grade 1s can be bred, but they should be bred to other grade 0s and grade 1s so that we continue to improve the breed by breeding up to dogs that are less affected or unaffected, and producing dogs that are less affected or unaffected. And if a grade 2 is going to be bred, it should only be bred because it has other qualities that should be carried on and reproduced. Then it should be bred to a grade 0 or a grade 1, so that you are once again improving the genetics of that individual and what it's passing on to its offspring, and not just propagating that problem in its severity as that dog has. So those are the recommendations, and it allows breeders to make their breeding decisions so that eventually everyone is working with grade 0s and occasionally some grade 1s, but we have improved the disease within these breeds and improved the health of those individuals.
You were talking about identifying affected dogs. One approach, as you said, mainly due to the very valuable work they've done at Cambridge University with Jane Ladlow, is anatomical features. Another approach that is very often taken by national veterinary organizations is a physiological approach, that they do exercise, an exercise assessment of these dogs to see in how far they breathe normally under mild or moderate strain. How is this to see sort of, is there anything, any test superior to the other? Should we as practitioners apply both tests? Are there other possibilities? Are there also genetic options that we could use? How do you see that?
Yes, so actually, Dr. Ladlow's work at Cambridge and with the UK Kennel Club, it is going for the respiratory function grading, the RFG, and they have licensed that examination procedure. It is an examination by a veterinarian that has specifically been trained to evaluate for BOAS for a dog at rest. The dog goes on a brisk walk for 3 minutes and the speed of that walk and the length and the duration are timed. And then the veterinarian re-examines that dog so that we are looking at a dog immediately after some exercise to see whether there are clinical signs of turbulence that are reflective of BOAS in those individuals. And that's how that 0, 1, 2, 3 grading system has been applied. Looking just at the anatomical features, what they have found is that the length of the muzzle and even the amount of stenosis or narrowing of the nares are not directly correlated to whether a dog is affected or unaffected with BOAS. But the functional grading, the respiratory functional grading, directly reflects whether this dog exhibits those signs with Sturter and Strider during an examination with a stethoscope as to whether they're affected or not. And the procedure is being licensed by the UK Kennel Club and the University of Cambridge to many countries and many kennel clubs around the world. It's been instituted in the United States by the OFA just last month in January. And so by compiling all of the information, including the pedigree information on these dogs, Dr. David Sargan is the geneticist at Cambridge. They're analyzing once we have multi-generational information to see how much improvement we're seeing in these breeds from the breeding generation down to what's being produced and being evaluated in the litter information to show that we do have improvements with BOAS, and also enables us to do more genetic investigations so that eventually we can have genetic tests and DNA tests to select against this disease syndrome.
Yeah, it is. As a general practitioner, I'm sometimes surprised sort of that certain breeds are very often affected, the pug, French bulldog, and yet we have other breeds like, for example, the Boston Terrier, who also have a very compressed skull, but they seem to be to a far lesser degree, if at all, affected by this condition. So just anatomy, just I don't know, sort of luck. It's just very interesting that we have sort of dogs with fairly similar features, and yet there is such a huge difference, nevertheless, in the quality of life of this dog.
It's very interesting, the research that's being done around the world. The French bulldog and the bulldog, as well as the Boston Terrier, they all are uniformly carrying a gene called the disheveled 2 gene, and that gives them their compressed body size, the wide head, and the screw tail. And so therefore we feel that there's linkage of that gene to the production of BOAS in that regard. However, the pug breed does not have that gene. They have a long tail. They don't have the screw tail, and but they have other genes that cause their wide face and compressed body type and brachiocephaly, and so this is the chore of teasing apart what is the genetics of BOAS, what is the genetics of extreme brachiocephaly that predisposes to disease, and that's what the geneticists are working on right now.
Different question. Are we able to breed ourselves out of the BOAS problem by keeping the breeding books closed? So by staying inside the current breeding books, is the gene pool, what shall I say, big enough so that we can manage to breed ourselves sort of out of it? I mean, to give you an example, the Dalmatian, and urolithiasis. This is something where taking in just a slight sort of additional genetic code from the pointer completely eliminates the problem with urolithiasis in the Dalmatian. So isn't it time that we need to look at the existing breeding books of some of the affected breeds and say, well, with that, what we have, there are just so few dogs that are unaffected. Isn't it better here to loosen a little bit the, what shall I say, the rules, and by taking in unaffected breeds, you just slightly change the conformation of the dog and you come to a far quicker result?
Yeah, there are many different ways to try to get ourselves away from this disease syndrome, and there are lots of people that are outbreeding and crossing breeds to to pugs and to other breeds to try to find dogs that are unaffected with BOAS, and if that's what people want, then I think that that's certainly a good endeavor, and maybe if they breed back and where those non pugs or whatever breed that they're working with are become far in the background, just as they did with the Dalmatians, that maybe the kennel clubs will accept those once again as purebreds and as a healthier purebred. But again, the issue that we're dealing with right now is we don't know the genes that are specifically predisposing to BOAS, and so taking dogs and breeding them and saying that this will create a healthier dog is a lot of guesswork until we have that more specific information, so that we know which genes are varying between a BOAS affected and a BOAS unaffected individual. And that's the research that's being done right now within the breeds. Then we can have much better control and a much better response to selection to improve the situation. And from the respiratory function testing that's being done around the world in many different countries, the percentage of these breeds that are clinically affected is not the vast majority of the breed. It does can approach up to 50%, but these are populous breeds. And if 50% of the breeds are not affected, and we can utilize those as our breeding population and work away from the disease process, then there's plenty of dogs and plenty of gene pool size to work with this disease and with these breeds and not make them endangered breeds, if that is what the public wants.
How far can veterinary education go? The reason I'm asking the question is, I mean, we have here a video with really the sharpest brains on the subject, talking in this video, presenting part of their research, giving advice to colleagues, to potential pet owners, to breeders. And yet I sometimes sort of wonder how far is really our reach. We are, after all, we are a small profession in a very, very big world. And I don't know, 2017, we had the World Small Animal Veterinary Association Congress in Copenhagen. And we had a symposium on the subject. And there was a considerable amount of media interest. Oh, great, the vets are meeting. And yes, they were taking interviews. But what they were most interested in was this here. I don't know if you saw this before. This is a high altitude mask. This is restricting the airflow. And what the media was mainly interested in was to see something that was simulating the effect of the disease the animals were suffering from. And that what eventually went out was not so much that what was presented at the event, but it was crazy veterinarians running around, running up and down stairs with these masks. So what do you think? How far can we reach as a profession?
Well, it's, that is part of the issue, is that the owners don't understand that their dogs are suffering, that the fact that they have turbulent breathing, the fact that they go to sleep with toys in their mouths just to keep their airways open, they think all these things are cute, but they don't understand that it is suffering, and Dan O'Neill's studies have shown that these specific breeds with the extreme brachiocephaly, they die a lot younger, mostly due to respiratory disease, and so this is causing not just debilitation and more morbidity through their lives, but mortality and death in these breeds, and so I think that did help. That is a good messaging. But in terms of what can our veterinary profession do, that's what we deal with at WSAVA in the Hereditary Disease Committee. How can we improve things? Even though it needs to be done on the breeder level, how do we influence our clients that we have the direct contact with to understand about hereditary disease, to understand that you need to seek out a breeder that is health focused? Because if a breeder is not paying attention to health issues specific to their breeds, or even if they're doing crossbreeding, which many will do, if they're not looking to choose healthy individuals, then they're not going to have healthy offspring. The number one hereditary disease that we see in practice as practitioners is allergies in dogs. And if you're not going to select against those that have clinical allergies, then you're just propagating the number one hereditary disease that we see in practice. And so a pre-breeding examination by a veterinarian of any dog that's going to be bred, evaluating the different systems, the heart system, the skin, looking at the histories, not just an examination, because allergies, if the dog does not in the middle of an allergy season, you're not going to see it on an examination of a dog, but you can look in the history and see that the dog is allergic. You can look in a history and see that a dog is an epileptic. You can look in the history and see that a dog has had bloat episodes. There are many different hereditary diseases that we can't evaluate through an examination, but as the primary veterinarian, we can look at the history and say, this dog is not really a candidate for breeding if you want to produce healthy dogs. And that's the message that we as veterinarians need to be passing on.
Yeah, and I think what is particularly valuable is also, and that is also where I see here the tremendous value of the Hereditary Disease Committee of WSAVA, is that you take a global approach in this subject now. So, I mean, there's one point if there are individual national veterinary organizations highlight the issue, but where it really needs to be addressed is on a global level. And that is what your group does. And I think that is also what the video does. This is, and that feeds again down to the national organizations. Unless there is a global approach where you say, this is okay, this is not okay, and please don't breed from these dogs, then again, people will take note, especially if it is backed up by authorities like yourself or the other authors or participants in the video. And I think that is where the video is just so valuable. The video is available on the WSAVA website, which is wsava.org/BOAS. And it's accessible for anybody who, you don't need to be a veterinarian, you don't even need to be a dog owner or a breeder. So take a closer look, see what we are talking about. Jerold Bell, thank you so much for joining me for this FECAVA Vet Chat. Thank you very much also for answering some maybe not so comfortable questions, but I think, I mean, this is a really helpful educational tool. And thank you very much to you and to the committee for having put all the hard work and information and knowledge into producing something for the profession as a whole. Thank you. If anyone is interested in other subjects that might be covered by FICAVA VetChat, please do email us on vetchat@ficava.org. Or if you like to comment on this or on any other episodes that we have broadcasted, please do so on that email address or by using our social media outlets. Thank you very much for listening. Thank you very much for watching on our YouTube channel. And I hope to see you again soon for another episode of FICAVA VetChat.